You might already know that low ferritin can be at the root of symptoms like fatigue, anxiety, hair loss, restless legs, and even thyroid problems. But how does low ferritin happen in the first place? Keep watching to learn what causes low ferritin and how you can restore your levels and resolve many of your symptoms too. Low ferritin is alarmingly common, as are the widespread consequences that result from having low iron stores. According to a major international study, nearly 1.2 billion people suffer from iron deficiency anemia, where iron levels are low enough to affect blood hemoglobin, and at least twice that many people have low ferritin. If you have any of the following symptoms, it could be at least in part the result of low ferritin. Hair loss. This is one of the big ones I see in my clients, along with other micronutrient deficiencies or insufficiencies. Fatigue, weakness, headaches, and dizziness. If you have chronic fatigue, one of the first things you need to check is ferritin. Anxiety, depression, poor focus, lack of recall, and an overall decrease of brain function. I had one client whose anxiety almost completely resolved once we got her ferritin into the optimal range. The brain and its functions are very sensitive to latent iron depletion. Hypothyroid symptoms like sensitivity to cold, constipation, dry skin, weight gain, puffy face, muscle weakness, and even menstrual cycles that are heavier than usual or irregular can be linked to low ferritin because iron is crucial for the conversion of inactive T4 thyroid hormone to active T3 thyroid hormone. Here's the tricky part. Most of these symptoms overlap with other root causes or are often brushed off as all in your head. And it's not easy to detangle all of these systems. But I'm here to tell you, do not overlook the role of iron reserves if you're struggling with these kinds of issues. But before we jump to the causes of low ferritin, we need to understand what it is and what it does in your body. Ferritin is a protein that stores iron in your cells, safely transports it in the blood, and releases it when your body needs more iron to do important things, like make your red blood cells and bind active thyroid hormone to receptors. We need this ferritin protein because while iron is a super helpful micronutrient for your body, free iron is actually toxic to your cells, so it needs to be bound up or buffered when it's stored. That's ferritin's job, to keep a reserve of iron that's ready to go when your body needs it without exposing your cells to harmful free iron. When you have adequate iron in your blood, but not enough ferritin, we call it latent iron depletion, or sometimes iron deficiency without anemia. So when we measure your levels of ferritin in the blood plasma, we get a sense for how much of a backup stash of iron your body has at its disposal, as opposed to only measuring iron in your blood directly, which is more common than measuring ferritin. Even if your iron blood test comes back within the normal range, it doesn't necessarily mean that you have enough reserve iron stored in ferritin to maintain all the functions of your body that require it. Given that ferritin is the most sensitive biomarker for assessing iron stores, it's surprising to me that most doctors don't bother to check it, even when their patients have common symptoms of low ferritin. If you suspect that your symptoms are related to low ferritin, especially once we get through all of the potential causes for low ferritin, it's a good idea to test it via blood work. Most of the time, you can ask your primary care provider to order this test for you, especially if you tell them that you're feeling fatigued or you have other symptoms associated with low iron levels. But be sure to specifically mention ferritin. Otherwise, you might end up with just an iron test. Alternatively, you may be able to order your own iron and ferritin test through my website. I'll put more information about this in the video description for you to investigate. For reference, I like to see optimized ferritin levels of 70 to 300 micrograms per liter for males and 70 to 150 for females, unless they have thyroid disease, in which case that bottom number goes up to a minimum of 100 micrograms per liter. All right, now you know what ferritin is, why it's important, and the types of symptoms it can cause if it's suboptimal. You also know what range you're looking for and how to get your ferritin tested. Next, we can talk about the 3 root causes of low ferritin and how to solve them. The first root cause of low ferritin is low dietary intake of bioavailable iron. There are 2 main forms of dietary iron, heme iron and non-heme iron. Animal-based food like meat, shellfish, and eggs have both heme iron and non-heme iron. Plants only have non-heme iron. Heme iron is absorbed at a rate of about 15 to 35%, whereas non-heme iron lands somewhere in the 2 to 20% absorption rate, unless combined with vitamin C, which can slightly improve its absorption. This is why folks who eat a vegan, vegetarian, or plant-based diet need to be especially diligent about monitoring their ferritin levels. You have to really be intentional to get adequate iron from spinach, tofu, nuts, and beans alone. Even if you're not eating a plant-based diet, it can be hard to get enough iron, especially if you consume a lot of processed or ultra-processed foods, which tend to be low in nutrient density overall. Also, because overall absorption rates of iron are low, it's really hard to correct a deficiency of iron or ferritin using dietary sources alone, even if you're loading up on good sources of heme iron like clams, oysters, and organ meats. The second root cause of low ferritin is poor iron absorption in the gut, because if you're eating plenty of iron-rich foods or even taking iron supplements, but your digestive tract can't take in all of that ferritin-boosting iron, it's just going to make you constipated. One reason for poor iron absorption is low stomach acid. Many people take medications that purposefully decrease their stomach acid, like Tums, Rolaids, milk of magnesia, Tagamet, Pepcid, and Zantac. And especially if taken for a long time, these meds can cause low ferritin. Atrophic gastritis, a condition where the cells that line the stomach lose their ability to secrete gastric acid, can also cause poor iron absorption. A Helicobacter pylori infection is the most common cause of atrophic gastritis, and approximately 60% of the world's population is infected with this common bacterium. H. pylori can also cause ulcers in the stomach, or even lead to stomach cancer in a small percentage of people. If you're struggling to absorb iron and you suspect gut issues, a comprehensive stool analysis can help rule out H. pylori and other microbial causes. I'll include a link to my favorite comprehensive test for checking H. pylori in the free ferritin boosting checklist for you. This checklist will also include links to my approved supplements for correcting low ferritin at the root cause, so be sure to snag that from the video description. The third root cause of low ferritin is accelerated or increased iron loss. A healthy adult loses about 1 milligram of iron every day in the stool, but a menstruating woman loses an additional 20 to 60 milligrams per cycle, depending on the heaviness and frequency of her period. I've worked with many women who have had heavy periods for years, only to discover that low ferritin is causing hair loss and thinning, fatigue, and mood disruption. Low ferritin can also be a result of past blood loss, for instance, pregnancy and childbirth, surgery, or other physical trauma. And iron loss can be accelerated by athletic training like running, especially long-distance running, as well as non-steroidal anti-inflammatory drugs like ibuprofen and naproxen, as well as aspirin, because they irritate the gastric lining, causing slight, slow bleeding over time. Anything that causes injury to your blood cells can eventually cause iron loss and low ferritin. If this sounds familiar, it's time to check your ferritin levels. So, what are some functional medicine strategies that actively address low ferritin at the root cause? If you're just trying to prevent low ferritin, increasing iron-rich foods in your diet can be helpful. But if you've checked your levels and you find them inadequate, you will likely need a concentrated, high-quality, absorbable iron supplement. My recommended ferritin-building product has a few distinct qualities. It contains a chelated form of iron, which makes it easier to absorb and less likely to cause digestive upset. It also contains several cofactors, specifically other micronutrients that are required for proper utilization of iron by the body, like methylated B vitamins. You'll find details about my approved supplement in the free checklist. And I'll even include a link where you can order it at a discount. Because an acidic environment is best for absorbing iron, it can be useful to take a supplement with digestive enzymes and betaine HCl to create an ideal gastric environment for absorbing iron. Taking vitamin C with your iron also helps increase its absorption. Every little bit helps. Another strategy that I find helpful for raising ferritin is to support specific strains of bacteria in the gut. I think of these friendly bugs like micronutrient doormen because they help ease iron's entry through the intestinal wall. One of the specific strains that has been found to boost ferritin is Lactobacillus plantarum. One study found that a probiotic containing this strain increased iron absorption by 50%. Like I mentioned, you'll find links to all of these suggested supplements for boosting ferritin in my free ferritin boosting checklist. You can sign up to get your copy at the link in the video description. I hope you found this video helpful, and I hope it gives you more ideas and resources for getting to the root of your low ferritin symptoms. Be sure to check out the free resources in the video description for next steps, including functional labs and ferritin-specific nutraceuticals. And if you did pick up some useful tips and tricks, be sure to like this video and subscribe. I'd really appreciate it. I do have other videos on ferritin, so feel free to stick around because I've got one all queued up for you. Thanks so much for watching, and I'll see you in the next video.